evening once again. This is Dr. Alalade here at Ask the Gynecologist. Tonight we'll be talking about, can you get pregnant if you're menopausal? So once again, join and let's have this quick 20-minute discussion tonight, and we'll be rounding up. So you should not miss this discussion. And if you have a friend that will benefit from this discussion, please ensure that they are aware that we are starting and get them logged in. Okay, I'm trying to bring my cameras so that we can all see. We're live simultaneously on Facebook, YouTube, and also on Instagram. I was hoping I could go live on TikTok as well, but I'm having some kind of malfunction, so I can't go live on TikTok. Thank you so much, Blessing. Thank you so much, Priska Neka, Steve. Thank you so much for joining. And also on Instagram here, we have Yetunde8080. We have other members joining in. If I've missed your name for any reason, it's not intentional. Just that sometimes it's quick to continue and not to lose track. So once again, tonight is Dr. J at Ask the Gynecologist, and we are live on Instagram, and we're also live on all our social media channels. So good evening. Today, like I said on this page, I'll be discussing about menopause. Can you get pregnant if you're menopausal? Yes is the answer, but there are some steps you must take, and those steps that are crucial that you must take are the things we're discussing here for the next 20 minutes, okay? Yes, thank you, Bukola. Yes, good evening. I'm happy to see you as well again today. Good evening to you. Luchivain Athanasios, Chiamaka, Rita Okonkwo, Jennifer Anslem, and Blessing Akimbody. Thank you so much, Blessing. Fumi Akiemi. And we also have on this page Veronica Abiyawu, Talk to Pretty, and Maureen, Dave, Sishola Jasin. All our team members are here. Mrs. Nika is one of our foremost members, and also Sishola Jasin as well. And other team members will be joining shortly. So today, what is menopause? A lot of people get menopause confused, and it's because there are a lot of confusion around it. First of all, menopause is not something to be scared about. Okay, and most people listening to me today are not menopausal. Okay, usually the average age of menopause in Nigerian setting would be around 53, 54. Okay, but it could happen earlier for some people. For them, we call it premature menopause. So if you see somebody stop having period around age 40, period stops before age 40, no period at all. We check their FSH is more than 30, 2 occasions. Another repeat again, FSH more than 30, 6 weeks apart, then they are menopausal. So first of all, menopause is a life-changing experience, and I will talk about it, how it pertains and matters to infertility. Okay, menopause is a stage you get to and there's no going back. It's like when you're born, you can't reverse it. So for us to make a diagnosis that somebody is menopausal is a critical diagnosis, which as a doctor gynecologist, I don't take for joke. It's a thing you must think carefully about. So if you look at the menstrual cycle of a woman, okay, when you're young, now this is fact, take it from me please. When you're young, before that age, 12, 13, for most people, there's no period. All of a sudden, you start having period. From around age 12, age 13, 14, 15, 16, at those times, the periods are so irregular. You can't predict when they are coming from or when they will happen. You see some young girls in classes in SS2, SS3, they're not even aware that their period is there. Suddenly they start to bleed and they're embarrassed. That's why, as a teacher, for anybody in SS1, 2, 3, you must have pad, so that in case that there is accident, they can be given. Now, I might be wrong, but that's my thought. Okay, I've not seen it happen before, but I know it can happen. You see young girls that they don't even know their menstrual pattern, they suddenly bleed in class during examination, they're embarrassed. The female teachers should have pad available that they can give to those pupils or those students to prevent embarrassment. So for during that early years, thank you, Sandra, Ayudu, Ekwago Lemebari, and Abatina, Uju, Umodika. For the first 3-5 years of your period is irregular. So when you're getting to that 18, 19, your periods now starts to become regular. From this, I'm using for most people average. Your period is now regular from 18 onwards, okay, till around age 50, 51, 52. So for most people, from around age 50, their periods start to become irregular again. So first of all, no period. Period starts, it becomes irregular. All of a sudden it becomes regular from around that age 17, 18 till around age 50, 51. Okay, then again it starts to become irregular. Okay, then it becomes irregular from age 50, 51, 52, 53, then it stops from 54 onwards, and there's no period again. Okay, once that period stops, it's called menopause. It does not go back. Now, before that menopause, you see that I explained that the period starts to become irregular. Today the woman is bleeding. So maybe January now, she's having period. January, February, March, no period. No period April. May, period again. May, June, July, August, September. Stop again, no period again. October. November, no period. December, no period. January, no. February, period starts again. And becomes regular for another 6 months again. That period where period becomes irregular, haphazard, is perimenopause. It's like a car that's about to stop working. It's doing then it stops. Okay, so that period where you have your irregular period is perimenopause. Then once your period stops, it's menopause. Now, before we make that diagnosis of menopause, we must do your blood test of FSH. FSH is follicular stimulating hormone. We do it 2 times, and those 2 times they will be at least 6 weeks apart. And if they are more than 30, we can comfortably make a diagnosis that this woman, this person has gone through menopause and the period has ceased forever, for life. No eggs, exhausted. That is menopause. Now, having said that, some people do have what we call premature menopause, where and it's about 1% of women in the whole world. Their period happens sometimes, they stops sometimes around age 40. I've seen before. It's not common, but it can happen. And I'm sure that looking at me, you've had friends that their period has stopped around age 35 or 40. And it can be hereditary, it can be self-induced, maybe stressful life, or sometimes people that are smoking alcohol. All these things are injurious. They cause oxidative stress and damage to the ovary and to the eggs and follicles. So if you're a lady smoking, run away from. I'm saying habitual smokers, run away from. Smoking is addictive, so to avoid the addiction, run away from it. Don't let it exhaust your ovary. Alcohol, run away from it. Alcohol once in a while, maybe once in 6 months, okay. Social, don't get drunk. But if it becomes habitual every day, it's injurious to your body. Okay, so stop it. Those things can cause premature menopause, and they do a lot of oxidative stress damage to eggs in the ovary. Okay, so that is menopause. Now, the topic of today itself is about getting pregnant in menopause. Is it possible? Yes, Damilola Adenaya is possible. Yes, Precious Adebola is possible. Yes, Tomi 23653 is possible. Now, 2 things comes to mind when people try to get pregnant in menopause. We've done their test in the IVF system, in the IVF clinic, and we see that their eggs are exhausted. They've gone through menopause. LH is so high. LH is about 50. FSH running to 80-100. Menopause has settled. Okay, we ensure that before making a diagnosis, that woman has got no period for at least 12 months. Okay, no period for 12 months, and they're not starting again. FSH more than 30 on 2 occasions, minimum 6 weeks apart. And also, it's essential also that we make sure that woman is not taking any hormonal medication, because if you're taking hormonal supplements, it can affect diagnosis of menopause. So before we do that test of FSH, we ensure that woman is not taking any hormonal supplements. So once we make a diagnosis, the eggs are exhausted, there's not much eggs in the ovary. One prominent option in getting pregnant with IVF is to consider, using egg donor for such a patient. Egg donor is possible. And even to increase uterine womb receptivity of this implanted embryo during IVF, we can do uterine infusion. This helps to revitalize the endometrial cells and makes them receptive to attaching and bonding with the implanted eggs. Okay, that is one option. Another option, so one option is to use egg donor. Another option I've seen works, not in all cases, but in some cases, is to do, which I mentioned yesterday, what we call uterine infusion and ovarian rejuvenation. Ovarian rejuvenation. These can help to revitalize any dull, any docile, any quiet ovary eggs in the woman's ovary. not to make her have regular period, but we can do your ovarian rejuvenation, which helps to kickstart any dormant cells, follicles still remaining, which can be enough to get a woman pregnant. Okay, but we also suggest that if you're doing your ovarian rejuvenation, do uterine infusion at the same time, because it helps to get the womb ready for the ovaries that will be released or collected. So another way, okay, to get pregnant, obviously, if you're menopausal, so don't forget. Now, you know you're menopausal. Egg donor, uterine infusion, ovarian rejuvenation, uterine infusion, surrogacy. You all know that, okay? But I always say that there's a cutoff which we adhere to in Nigeria. Once a woman is above a certain age in Nigeria, we don't do IVF because it's not ethical. Now, so you need to check with your IVF centers to ensure that you know and you're aware of that. Okay? Andelina Bartholomew Dogaravandi Venjay Damilola Adenaya, thank you so much. Now, definitely you're going to have questions now. Okay? So as I'm talking, I want to entertain questions, because that means that you're listening to me. That means that you're able to contribute. That means I can even get feelers from those questions to know what people want to be discussed, because sometimes it's easy for me to just talk. But if I get questions as I'm talking, it helps me to tailor my discussion to the things that you need or want to hear, and also to what matters in your mind. So if you have questions, it's time to answer, or to ask them, and I will answer them. Okay? If you have questions, ask them. Let me answer them. Okay. So people will ask, Princess. Yeah, thank you, Princess. Somebody asked me a question yesterday, and during that yesterday's session, which we had here, I talked about blocked tubes, okay, and I talked about frozen embryo, okay. Now, if tubes are blocked, okay, and we've confirmed that they are blocked, okay, and we've done the test necessary to get to know, test which we discussed yesterday, HSG, which people are scared about, which I try to allay the fear of people. HSG is necessary. The other test, sonohysterogram, to check, and also you have saline infusion, sonogram, to check the tubes. Okay. Now, somebody asked me a question yesterday, that is the HSG done to unblock blocked tubes? And I explained yesterday that HSG is primarily designed to see and to know if the tubes are patent or blocked. But as I know with experience invariably, that sometimes when you're doing HSG, some tubes that are just a bit occluded can get opened with the force of the HSG itself. And I've seen people get pregnant by having sex shortly after their HSG. So that even gives you a reason why you should do HSG in any way, because you don't know if your tubes are open or closed. You've been trying to get pregnant so long, nothing's happening. Now you've done your test. Now you need to do tests, and you've done your HSG test, or you don't want to do HSG test. That HSG test you need to do might even give you information to know if your tubes are blocked. And if the tubes are indeed blocked, HSG might even be enough to open it. And if it doesn't open it, at least you know you've done your best to know if they are blocked or not, and you've given yourself the best chance to open it if they are blocked. So that's why I always support going for HSG, and I always try as much as possible to allay anybody's fear about HSG. Somebody's saying that which supplements increase air quality? So supplements that improve and increase the air quality, we know. I've mentioned this all the time here, and on our page we have it on our system, and we have large stock at our office in Lagos. And I told people that you can send message to our office tomorrow, WhatsApp, and they will discuss with you how you can get it sent to you wherever you are in Nigeria. And we have Fatty Male, Fatty Lady, and these supplements help to give. They contain potent antioxidants. Antioxidants reduce aging. Antioxidants reduce stress. Antioxidants reduce damage, or what we call oxidative damage in the body cells. And there's no other body cell that are actively dividing and actively dividing like the sperm and the eggs. Those two cells are actively dividing, and they respond well to oxidative damage or oxidative repair. And those supplements that we're talking about, the fatty men, they contain potent antioxidants which help to revitalize, which help to repotent, which help to potentiate, if there's that English anyway, to and give good energy. Good potential to your sperm and to your eggs. Basically, the supplements contain antioxidants and they help to reduce aging, and invariably they increase the quality of the eggs and of the sperm. So just message that, in fact, our team members, Tishola and Cynthia, they've already put, and Deborah, they put up the link for our numbers, so you can save them down, take a screenshot, call us tomorrow or text us tomorrow, and they'll give you the price and how you can get it sent to you wherever you are in Nigeria. Okay? There's a question here on YouTube. In a scenario where the left fallopian tube is slightly blocked and the left ovary are not growing, can the person get pregnant? Yes. I always tell people on this page, and it's a fact, that you only need one tube to get pregnant. I've seen people that they've had their fallopian tube, right or left, one of them removed, and they only have one good tube, which is perfectly okay. That one is enough to get them pregnant, and they do get pregnant with only one tube. So, Charity, if there's a blockage, okay, in the left, okay, and the ovary on the left is not doing well, as far as the right is okay, right tube and right ovary, they can pick up eggs and get you pregnant. In fact, let me tell you something. If you've lost, for example, if you've lost one ovary, let's say left ovary, the left ovary has got no eggs, it's not ovulating. Let's give just an hypothetical example, okay? But the left tube is okay. Now on the right tube is damaged, but the right ovary is ovulating. That left tube that is okay can pick up eggs from the right ovary. Yes, they have some GPS sensory mechanism, and they can pick up eggs wherever the egg is released to. So don't worry, okay? As far as you have one good tube, is okay. What spices could I put on roasted cat? This is a joke. You can put garlic, you can put thyme, you can put curry, you can put Mediterranean sauce, you can put Caribbean jack, anything spicy, put on your cart and you eat, okay? God bless you. Good evening, doctor. Is it normal to experience sperm leakage after HSG? Sperm leakage after HSG? No. So after HSG, that contrast will push in. It will come out by the force of nature called gravity, force of God, gravity. If any woman has sex, okay, whether she hangs her leg on that ceiling for the next 24 hours, once she put her leg down, sperm will come out once she go to pee. It's normal. It's called force of gravity, and it's the force created by God. So your sperm pouring out doesn't mean you can't get pregnant. Let me tell you something, okay? Now, that sperm that pours out is just semen. It's fluid. It's seminal fluid. Inside that semen was sperm, and that sperm has already swarmed into your womb. So the remaining fluid that will liquefact, or we call liquefaction, is what you're seeing pouring out. It's not going to make you unable to get pregnant. The sperm you need, and there are billions of sperms from one ejaculate, they're enough to get you pregnant as far as they're good quality. So anybody that has sex, there'll be leakage of sperm out because it's normal. What I want to say now, okay, doctor, hey, okay, you will leak a bit. I will not hang my leg, my sister, it will still pour out. If you get up, there's nothing you can do about it. And you have to walk. You can't hang there for 1 year. It will come out. Okay, so don't panic. You only need the good sperm quality. Now, after HSG, the contrast will pour out. Sperm will pour out if you have sex afterwards. It's normal. It's okay. Olabisi, thank you so much, my sister Bayode. Ngozi Obiajo, thank you so much for joining tonight. I really appreciate you. And once again, lovely to see you. Yeah, I'm trying to pick up questions here on the screen. Thank you, Cynthia, once again. Thank you, Adamilola Adenaya. So now, I hope you've taken notes. Now, if you've missed the discussion, you can always piggyback, watch the video again at your own free time, and capture and get the gist or the meat in case you've missed anything during the discussion. Faith Ibubuke, thank you so much, Faith. And yeah, thank you so much, Cynthia. I can see your fingerprint on Instagram. Messi Rogers, thank you so much. Thank you, Cynthia. Cynthia is one of our managers at ATG, and she's already putting up our numbers, and all our numbers are WhatsApp enabled. Teresa Olabode Adeyemi, thank you so much. Can a woman of 47 get pregnant? Yes, if you're still ovulating. But if you're menopausal, you might need help. Or if you're too self-blood, you might need help. But it's possible to get pregnant at 47, even at 50. You can get pregnant. Okay? Now, as I was saying earlier, that I know that before I was explaining about what we call perimenopause. During that perimenopausal period, You see a woman that is 52 and she got pregnant. But you say, but this one wasn't, this man said, but doctor, I wasn't having any period for about 12 months ago. How can I get pregnant? It's possible because during your perimenopausal period, your periods come and go, haphazard, irregular, 3 months, 6 months, regular period, another 3 months, no period, or irregular period. You can release an egg during that time and you can get pregnant. I've seen a woman that got pregnant and had triplets at age of 52. Natural though, not IVF, natural in this country. Natural. Is IUI for blocked tubes? No. The first prerequisite for IUI is 2 things. The tubes are not blocked and the sperm is okay. If the sperm is not okay, they will have to use the donor sperm. If the tubes are blocked, you can't use IUI because you only pour sperm there and there's no egg there because the tubes are blocked. So IUI, blocked tubes, no. Okay, no. Okay, that's very important question. I love you. Thank you, lady that asked that question on YouTube. IUI, blocked tubes, no and no. Thank you so much, Antonia Chinasa. So I'll log out today. I just want to catch up with you today. I'm going to release some reels on Instagram. Catch up with me. See you soon. Have a wonderful weekend and have a wonderful public holiday tomorrow. I think it's Eidul Maulud, I think. God bless you and have a wonderful celebration. And God bless our Muslim brothers and our Muslim sisters all over the world, especially in Nigeria, Ghana, in Africa, and in the diaspora as well, most importantly. God bless you. See you soon. Have a wonderful weekend. Have a wonderful day. Bye-bye.